Now, the osseous segments of the shoulder complex are the clavicle, scapula, and humerus. This is the clavicle, this is the scapula, and here is the humerus bone. The three segments are joined by three interdependent linkages. What are they? They are the sternoclavicular joint, the acromioclavicular joint, and the glenohumeral joint. Now, there are two specific areas which are very important, and this is the scapulothoracic articulation. Here, it is not a standard joint because it doesn't have any fibrous, cartilaginous, or synovial union, but scapular motion on thorax is directly a function of SC, AC, or combined sternoclavicular acromioclavicular joint motion. The ST joint is frequently described in the literature as a functional joint. Now, which is the other functional articulation which is of this type? The other functional articulation that lies in this area, and that is known as the subacromial or the suprahumeral joint. The movement of head of the humerus below the coracoacromial arch. This suprahumeral space is considered as a part of GH joint, but for better understanding of the scapulothoracic movement and the scapulothoracic rhythm, we are considering the scapulothoracic articulation as a separate entity. Why this is important? The joints that compose shoulder complex in combination with the trunk motion can contribute as much as 180 degree of elevation to the upper extremity. This elevation is either forward, the flexional elevation, or to the side in the sagittal plane flexion to frontal plane abduction, and all the motions in between. The motion of scapula on the thorax normally contributes about 1/3 of the total motion necessary for elevation of arm through the linkages of SC, sternoclavicular, and AC, acromioclavicular joint motions, whereas the glenohumeral joint contributes about the 2/3 of the total motion.